Become a subscriber to Wikisana now.
Welcome, dear viewers, to our natural medicine format today. Week after infections, chronic tiredness, listlessness, or other reactions in the body, which are sometimes completely indefinable, and we often hear the answer that unfortunately there is nothing we can do. But what if there were methods and possibilities to regulate the body again, to get it back into good shape, reactivate the mitochondria? And that's what we're talking about today with our guest, Dr. Harald Burgard. You can look forward to it. See you soon. Hello, dear Harald. Nice to have you here.
Hello, dear Corina. Good afternoon.
Yes, you're booming at the moment. Because of our last 2 or 3 years, there have been a lot of, yes, diseases, but also measures, where now, of course, the consequences have also arisen, where you really have to say, okay, it's all still a bit like that. We don't yet know how we can manage or act on this. We have a lot of patients who are completely exhausted and say, nobody can help me. There is no solution and no possibility. And of course, we know that too, I say, from the classical orthodox medicine, that there then nevertheless somewhere the tools are quite limited. I'll say that now. And you just have another new field. You have been dealing with the topic of stress in the body for 20 years, environmental stresses, and also ways to regulate the body again. And now, of course, the question for you, what? What are the issues that most patients have now?
Yes, Corina, for 2 or 3 years now, we have actually been flooded, but it's not just us from university hospitals and so on with patients who simply can't get back on their feet after viral infections, who are tired, who develop intestinal disorders, who are simply ill. They no longer can manage their life, and of course they want help. And the general question in science is how? What can you do? And all the researchers, clinics, and so on are also running at full speed and somehow try to help people. But it is simply difficult. And in the meantime, we have found that if you detoxify people sufficiently, that is, if you remove environmental toxins, antibodies, autoimmune, inflammatory triggers, substances, and so on, then you can regenerate them again. And this happens very quickly in some cases. Sometimes it takes a while. But the bottom line is, if you do it right and does it long enough and often enough, you can help many people to live a normal life again. That's what we want to talk about, how to use toxopheresis with a special blood wash to remove environmental toxins, antibodies, inflammatory substances, and so on, can get his life back under control.
We really have made a change through certain measures in the entire hemogram. So what exactly happens when you say, I simply did certain things and I have symptoms like tiredness, pain, whatever? What hemogram or tests can I use to weigh up my options? Was that good or was that not so good, what I have now fabricated here?
Yes, the patient himself can do relatively little about it, because he always needs a doctor or an alternative practitioner who can and wants to determine the values. And that's where it starts. We usually don't see anything in the normal complete hemogram. And then it is said that people are healthy. You're stressed, relax, do something. But it is not medically, physically ill. This is often wrong because people simply don't look hard enough. That's when I look in the trunk of the car and say, in the trunk, you have enough tire pressure, the treads are fine, yes, enough oil in the engine. Everyone will ask, how can he see that? You can only guess, but I can't see it. And that's just the way I have to be. When I do analyses, I look at the right things. And that's what I see again and again, that there are simply gaps. I'm basically someone who looks at the gaps, because I know from the experience of the last 20 years where to look. And when people come who are seriously ill, following viral infections, or cannot get back on their feet after other measures, then we often find symptoms such as poor concentration and shortness of breath. They can't remember anything. They notice, they simply forget things. Yes, they have trouble sleeping, their muscles hurt, their muscles are weak, the mood goes down, people are sometimes anxious. They are also often conspicuous because they no longer smell or taste good. I have just treated a patient who came in and said to me, "If you don't help me, I'll kill myself." He always had a tinnitus. He smelled nothing, tasted nothing. He couldn't stay up from midday. He always had to lie down for 2 or 3 hours. Yes, I have treated it several times now. Now almost everything is gone, and that is a completely new life for these people. And it's been like this for 2 years now, and no one has been able to help him.
And young people often have this now too, where people say you are 20, sporty, super.
It affects young people, it affects children, it affects adults, it affects senior citizens. This is all independent, and sometimes, unfortunately, with severe courses. We have quite a few patients who now come with ALS. This is a life-threatening disease that is usually fatal. We have people with severe chronic fatigue, but we also have people with MS, with after such infections, tumor exacerbations, and so on. And there is always a mixed load in the background that is already there, that they already had before, from various poisons. I have never seen anyone come in with severe chronic fatigue, with a reaction to whatever, without him already being burdened in the background. And then when we look, and I always look at the people, what about deficiency symptoms? What about viruses, toxins, and so on in the body? You will always find a mix that is already there, from many things, from pesticides to insecticides and plastics, about no idea what about paints, varnishes, coatings. However, you will always find chronic exposure to pathogens. You will always find a bowel disorder. They often have them here in the mouth, in the jawbone, in the sinus area, in the tonsil area. And you have to detect that. This can be proven in the laboratory. And then you find antibodies that disrupt the body. And to come back to the question now, what do we prove? Well, we'll just look more extensively in the blood. For example, we're looking at the edge of CCL5. These are toxins that are produced when something accumulates here due to dead teeth, root-treated teeth, or through so-called FDOCs, NICOS, i.e. areas in the jawbone where pathogens can suddenly get up to mischief. We look for inflammatory substances such as TNF-alpha, tumor necrosofactor alpha, after interleukin-6. This is often elevated, mostly in the acute phase, but also sometimes afterwards. We look for VEF. This is a growth factor that if it goes too high, tingling, numbness, cold warm sensory disturbances can lower blood pressure. We often find elevated interferon gamma, which shows that the immune system is tilting. Interleukin-8. However, we also often find autoimmune antibodies that disrupt your muscular and nervous system, can block the receptors, and then make you dead tired. These are just a few laboratory parameters which we find and which are conspicuous in many cases. But these are exactly the parameters. As I said, these are just a few which are not normally looked at in traditional family medicine because it's not on the radar. And then you don't find the conspicuous things, and then says with the default values, nothing is found, so the patient is healthy. And then you are often wrongly psychiatrized. Yes, and people often come and say, yes, we have now consulted a psychologist, a psychiatrist. No one can really help. It doesn't help if I then start baking somehow, or do sports or anything like that. They can't do that. This does not change the cause. In my experience, you have to eliminate the causes. You have to reduce the inflammation by reducing the antibodies. I mean by taking out the toxins. I have to eliminate the antibodies by taking out the toxins, by eliminating the pathogens, by sanitizing the teeth, by looking at the intestines. Yes, by looking at toxopheresis. Just relieve the body as much as is feasible and possible. And then the energy formation can come back. Then the mitochondria regenerate again. If I supply them with Q10, magnesium, and whatever else, if I take out the viruses that shut them down, when I remove the environmental toxins that block everything, then the body can regenerate again. It has an incredible ability to regenerate itself.
That's actually the beauty of it. But then we often lack them too. As you say, the trunk that we look at it, we just get paid for it. But if we just have someone who then really pull out the oil dipstick and measure the tire pressure, then will it be more expensive? Yes, it is.
That is simply the problem. Of course, in Germany, we have medicine, thank goodness, which offers much more than in most other countries. I sometimes have patients from South America or Iraq or wherever. They don't have any or almost no supply. We are already in a really good position. But of course, there are limits. We have a cost containment principle. The panel doctors are only allowed to do certain things. And if they go beyond that and now want, for example, laboratory values that are not usually paid for, then they have to make an agreement with the patient. Then he has to pay for it privately. This is all the effort that a panel physician cannot afford due to the high influx. Not that my colleagues can't do that. They're no stupider than me. That's not even a question, but it just doesn't fit the pattern. And especially when a person comes with special illnesses that you don't even know, then you are simply overwhelmed. Then many specialists are simply overwhelmed. And as a clinical environmental physician, you are used to such things. I'm used to looking things up. And as I said, I just look for gaps. And I also have to do more lab work. And of course it costs a little more because I demand it, but because these are laboratory costs that the laboratory charges. But it is necessary because otherwise I'm treating a black box and then I can treat with guessing. I just prefer to have facts and see lab results and know I have to attack there. And when I treat this, I can also see the abnormal laboratory values that they normalize. And then I know, okay, that worked. The patient knows this, and so does their health insurance company or whoever is looking at it. You can simply prove it.
Now we have this. What exactly has happened? So we already know this from previous flu topics with this chronic fatigue and stories like that, but now it's massive. Once because someone got it normally, or someone else has just taken special measures, but what can the body do? How can it regulate itself again? That the storm that has been unleashed, which we cannot yet control, again?
Yes, for this particular form of the disease that we have seen over the last few years, it is indeed the case that cells are affected more intensively than we knew before. Or maybe we just didn't realize that before. Seen in this extent, we see that toxins are being stirred up, and when I say see, I really mean it literally. I see in the elode, in what we have here in a bag like this, that there are real lumps of dirt in there, for certain diseases, for certain viral histories. Even if someone then comes and has now 2 or 3 days ago, or a viral infection 5 days ago, and it is stirred up in the body, like throwing a stone into a pond. That's where the dirt goes up. That's how we see it there too. And when I take out this dirt that makes you sick, I can see that people are slowly or suddenly getting better. But the things that are in there make people sick. We have known that for a long time. Metals or other toxins often make you permanently ill. There is Haber's rule for cumulative toxins, which states, if I now take arsenic or any other poison in large quantities, I get sick immediately. If I have the same poison in a small amount in my body over a long period of time, then I get just as ill, but later. That is simply the problem. And then it's not the case that we have one thing in our body, only arsenic or only mercury, but we have arsenic, mercury, lead, hever. We have paints, varnish paint, what you see here, and that is what we remove and what we prove. And the more we remove from the body of a sick person, the more he can enjoy it. Because you can imagine that you're sitting on the floor and 20 people are on top of you. You just can't get up. So now, I'll take you down one by one, and at some point there might be 2 more on top, and you can get up, you can manage them, and you can imagine the immune system in the same way. It's simply overloaded by all the dirt. No? And what we do about the toxophores, patient lying comfortably in bed. We take blood out of one side, the filter, we return it cleaned, and then simply remove it, without having to give any infusions, chelate, or anything else, simply by filtering toxic metals, including gadolinium, which also often contaminates people, or environmental toxins, benzenes, solvents. DDE, for example, is a substance that you find in so many people. Is that forbidden for 20 years? E605 paraquat has been banned for decades. We still find this with almost everyone, but also with silicone when it comes loose from the breast implants, for example. Varnishes, paints, and microplastics and whatever else. These are things that we take out. And we're not talking about 1 or 2 substances. We are talking about hundreds of substances that we find in such an eloate. And when I pull that out, then of course, the inflammatory substances just mentioned will also decrease. This can also be measured in every patient. I have taken thousands of measurements. Yes, and then we see the erythrocyte sedimentation rate drops, the CRP level drops, fat oxidation decreases. Many people are not even aware of what this is. We know fat oxidation from the evil LDL. We always say that high cholesterol is dangerous. Why? Because the evil LDL is too high. But you need the bad LDL, because the bad LDL brings your cholesterol there, where it is needed in the body. The problem, however, is when this LDL cholesterol oxidizes. In a car, you would say that the mudguard has rusted, and a rusted mudguard otherwise just looks stupid. Water also runs in there. If it is rusted through, it becomes unusable. And LDL cholesterol, when it rusts, becomes just as useless. And then scavenger cells come and absorb it. And unfortunately, for whatever reason, store it in the vessel walls. And then it looks as if there are cells there who have foam in their belly. And if you look at old textbooks on arteriosclerosis, vascular calcification, it always says that it starts with foam cells. And today we know that it oxidizes the LDL. And then it's dangerous. And why does LDL, this MDL, oxidize? Because there are free radicals that lead to, and the free radicals in turn arise because there are toxins in the body. There are pathogens in the body that lead to inflammation and then ejects this cascade. This is something we can think about, for example. Nitrothyroxine is an NO gas. In 1998, the Nobel Prize in Medicine was awarded for this discovery, that the body forms a gas, an NO gas, in every cell if foreign bodies get in, as first defense fronts, of course, also to expand vessels and so on. But if this occurs in excess, it oxidizes structures, and then so-called free radicals are formed, which in turn damage the blood vessels. Blah, blah, blah. TNF-alpha is also a value that can be lowered. That's all we ever prove. ECP is a value that is normally considered in asthma. However, we can see that this is an inflammatory value that can be found on the intestinal wall, is triggered, which causes inflammation, which causes allergic reactions, but is also toxic to the nerves, and which is damn high for many, many patients. And it always goes down when I'm detoxifying the patient with a toxopheresis. So we have a variety of situations, including histamine in the blood, which causes allergies, but also inflammation. And if there is inflammation, then the brain also becomes inflamed. This always goes up when there is inflammation in the body. And these are the explanations as to why people then get brain fog and so on. And when I detoxify the body, these things go out. Antibodies that trigger autoimmune diseases are then also released, Hashimoto's or Juckern's syndrome, or whatever. The dead make tired, then circulating immune complexes go around in the body. That can cause pain, that can cause inflammation of the bowel. I always say, these immune complexes that the immune system normally eats up, if they are formed too much, because there is too much dirt in them, then it can no longer do that. Then, the immune cells leave the food behind, because they are full. And what then circulates in the body is like when a horde of teenagers walks around with a baseball bat, and here and there, knocks on the house walls. And that is what causes pain in the body. These are all things that we can extract via toxopheresis. And then you can also see that it is precisely these autoimmune antibodies that make you tired, that this long-term fatigue, these long-term consequences that we have just talked about, cause them to decline. And we have different beta-1, beta-2, M3, M4. There are more. I've just taken these out. And you can see that they don't go down so linearly. They go down, a little up, a little down, a little up. But the bottom line is that when I detoxify the patient, they go back so far that they are within the normal range afterwards and no longer cause problems for people. And then comes the chronic fatigue, the brain fog, the whole malaise that comes after such viral infections actually goes away. Yes, and as I said, we can also extract viruses directly when they are traveling in the blood. We can reduce them significantly. We can seal the blood-brain barrier. We can ramp up energy generation, improve blood circulation, and above all, in a gentle way. And that is something that is also important, that you treat people with procedures that they can tolerate and that lead to this afterwards, that they become even sicker or are at high risk. Here we have virtually no side effects with toxopheresis. Yes, a little swelling under the eyes, a little swelling of the hands and feet for a few hours, sometimes a little hoarseness. Some people also say, I'm tired. I have to lie down for 2 or 3 hours afterwards. But this is nothing in terms of side effects compared to other procedures.
Yes, especially after many years of stress, or the chronic fatigue at the end of the day. Do you also combine this with other therapies, or do you then always depend on the patient?
Yes, we always combine this with other procedures. In other words, we always look at what problems people have in their intestines. What does he have? You send them to the dentist if necessary. Of course, you also have to treat the pathogens. Procedures are then also used. Oral administration of phytochemicals and other things, blood lasers and so on. So it is always combined with other procedures to the extent necessary. And I once had a patient here, for example, who had, suddenly developed blisters on my hands that wouldn't go away. They have burst open. She went to university, did some logic tests, and so on. That didn't help her. Body aches, paralyzing fatigue, and so on developed. And then we did apheresis. And after the second apheresis, she no longer needed painkillers. She was able to go back to work. She was fit again. The previous fibromyalgia pain was 90% gone. She always had abdominal pain. No more abdominal pain, hardly any bloating. Since the uterus was removed, she has had chronic bowel pain. Headaches and migraines gone. Tension in the muscles gone. And I also often see when we do toxopheresis that suddenly people say, I can stand upright again. I don't have any burning pain on my body, and it lasts. Quality of life better. And yes, and then after the fourth toxopheresis she had rashes all over her body, none more, also completely gone. Yes, and there was only a little bit left on the hand and under the breast. And that is just one example of hundreds that I could name after such treatments that occur when the body is detoxified and he himself is able to regenerate again.
It's actually frightening what methods we have to resort to get the toxins out of the body. So, if you ever see what kind of... it's good that something like this exists, but just imagine that.
You have to assume that our body detoxifies what it has always had to detoxify. Until 250 or 300 years ago, we had all these metals, and all these toxins that we have today are simply not in the environment. This means that your body had to detoxify what poison you have produced yourself, and also a little from the environment. Today we have stress, even in small children. There is a professor from South America who has children and teenagers who have died as a result of accidents or whatever, tested in Mexico City and in the countryside, and examined their brains and thought about it, looked at it. Do they already have Alzheimer's-like changes? It has been found that 51% of children from Mexico City, the changes were already there, as we find them in Alzheimer's patients, and with 0% of children in rural areas. This shows how environmental pollution works. That is quite serious. And today the body has to detoxify things that it didn't need before. But 10% to 50% of all people on Earth have a detoxification enzyme disorder. Half of the people on Earth lack the enzymes to detoxify toxic metals because we never needed them. And that's just like I said in the other movie. If you have a car without an engine, you can do whatever you want with it. It will never drive, no matter how often I polish it, no matter how well I look after it. He won't be driving. And if these motors, these detoxification enzymes are not there, you can't get the dirt out. And then procedures such as chelate therapy and toxopheresis are needed to pull the stuff out. We've known it for years. If a kidney doesn't work, we do hemodialysis, so that man survives. And here we do indeed have more and more people who are polluted. And that's where we can use such procedures to actually relieve them effectively.
Super, if you really want to find out a bit more about it. Where is the possibility?
Yes, you can contact my practice. You can look on the internet at dburgard.de. You can write to us by email. You can also call, which is always a bit more difficult, because a lot of people call. But of course, you can also focus on QS24 for a little more information that we have already provided in the past. And if you have any questions, just get in touch and ask, and we will provide you with information.
Super. Thank you very much, Harald. I wish you continued success and hope that many people will be able to regenerate. Thank you very much.
With pleasure.
Dear viewers, yes, it's still an interesting topic, this chronic fatigue and the consequences. And it's always good to know that there is hope and ways to relieve the body. And I hope you were able to take something away with you. Thank you for watching. See you soon.